Hello, Diaz here, founder owner Greenwood Dental. Welcome back to another video. Today we are discussing enamel. The question about enamel and the science of enamel and the making of enamel comes by very often in our practice, at least my practice. So I thought I'll make a video explaining what enamel is. I'm sure you guys can Google it. It's not that hard. But also I'm going to add to that like I said, always my observational data and what could happen to enamel and what causes it. So enamel basically is a dead skin. When I say dead skin, it's not made like skin, but think of it as dead skin because it has no nerve innervation or attachment to it, and it has no blood supply to it. And that's what makes it super hard. And it's said to be harder than our bones because there's no blood to make it softer or flex as much. It's very hard to crack enamel. It's very hard to break enamel. However, I'm in the business, so I deal with broken enamel, broken teeth all the time. Now, a couple of things can happen to enamel. For example, on the stage of gestation and with fetuses, if the mom gets a fever or gets antibiotics, too much antibiotics, it can interfere with enamel development and formation. Then the enamel will come through very patchy, very what we call soft teeth. And those need to have extensive care and extensive tracking of the integrity of that kind of enamel. Also, that's as far as baby teeth. When that same child gets rid of all the baby teeth and they're super healthy, not a lot of fever, not a lot of ear infections, not a lot of antibiotics, then they should have the second set with very healthy enamel. Now, if they go from age 0 to age 4 with high fevers and a lot of ear infections, sometimes we'll see those white patches, which is hypocalcification of enamel or weak enamel or soft enamel, form or develop in those children. Now, you can definitely chip in enamel if you had braces, and the way they take the cement off the teeth after braces, it's so medieval, it's so primitive because they scratch it off with this instrument. They can't use burrs. In our office, we have these special gold carbide burrs that can actually remove cement or composite without scratching the enamel. So it's very, very important for us when we do Invisalign and remove attachment not to scratch the enamel. The moment you scratch the enamel, since the enamel needs to be sealed and smooth surface and hard and not porous, then you start seeing a uneven surface. You start seeing stains. You start seeing a penetration of acidity in food and coloring. You start seeing sensitivities. You start seeing chipping, thinning of the enamel by grinding your teeth together. Also will thin out the enamel, and as a result, you go bite on something very, very soft. And the statement when patients come in, I always tell them it's not what you ate that actually broke the tooth, it's how long you've been grinding and thinning out the enamel, and then you go eat something really soft or even hit it with a fork and it will chip right off. Chipped enamel is so hard to fix, especially if it's small areas. Most of the time we end up shaving or polishing or smoothing out or evening out the enamel, and since killing two birds with one stone, you're gonna get rid of the thin enamel, the weak enamel, so you can land on thicker enamel, and also you can even things out, because try to bond something that small like a chip enamel, it doesn't last. So enamel sensitivity could be from also scrubbing your teeth too much with a hard or medium even toothbrush. It could be the over drying the enamel, depending on your habits, smoking, taking also eating the wrong things, taking a lot of medication that makes mouth super dry. That will make everything kind of chalky and not smooth and shiny and lubricated. So it's very important to maintain that 2 mm thickness of enamel on the teeth to protect the teeth. That's the only thing that can actually protect the teeth from any dental or tooth condition, is a sound sealed enamel. I hope this answers some of your questions. I'm out of time, and please let me know if that helps. I know you can, Google things and read stuff online, but I want it to come from me to you guys, since this is our patient outreach program from Greenwood Dental Partners. And I'll catch you on the next video. We love you. Be safe, and DS out.